Welcome to True Health Tuesday, and the truth will set you free. The truth that we can talk about. Now, if you're watching this, you're definitely not on YouTube right now currently because we're only going live out to Facebook because we are in YouTube jail. I like this. Quarantine is when you restrict the movement of sick people. Tyranny is when you restrict the movement of healthy people. That was an old thing I put up a while ago. I guess it's still true and will be true after the November elections. Okay, now, if you're watching this, please hit subscribe because eventually you're going to see this on YouTube. Those that are supporting Dr. BVIP, they're going to watch this uninterrupted. And thank you for your support because we've been demonetized, shadow banned, and just like the Matrix, we are still here. Okay. Oh, and this coming Thursday, actually next week, our Dr. BVIP, we're going to talk about arthritis reversal in great detail in English. Okay, so we're not going to be using a whole bunch of Latin terms, but you're going to see how the body regenerates itself all the time. Then that's like probably my favorite thing that I do every month. Extreme Health Academy, I'm going to be on there this Sunday for about a 2.5-hour webinar. Bergman 14 is still, you get on there for 2 weeks for free, so get on there and support those people. Arthritis. Now, we're going to talk about the importance of the cervical spine. The curve in the neck is also called the arc of life. Okay, why? Because at the base of the skull up there, you're going to see extending down in there. If you could see with your x-ray vision, the brainstem actually comes down in there. So the brain doesn't stop at the skull. Part of the brain extends the third part of the neck. And this is the cardiac and respiratory center. And then you have the nerve to the diaphragm that comes out of the middle of it. So you have the heart and brain center there, parasympathetic nerve supply to the heart. You also have all the nerves plexus that supplies the whole upper extremity. So this is carpal tunnel, rotator cuff problems, elbow problems, golfer's elbow, tennis elbow, breathing issues, and also Parkinson's, because if that heads forward, we're literally causing a stenosis. Now, arthritis, arth means joint, itis means inflammation. So if I say arthritis, you think I just said joint inflammation. Except what you're looking at is osteoarthritis, which is a non-inflammatory joint inflammation. Don't give me that look. Weed's legal in California. Okay, so you're going to be thinking, that doesn't make any sense at all. It's true. It doesn't make any sense. See, the medical world is going to make mistakes and not tell you about them. This is why almost everything is in Latin and they make it confusing. This is a priesthood. It's a priesthood involving toxic chemicals to alter physiology. This is also called degenerative joint disease, and it's also called degenerative disc disease. So you might think it's a disease. You would be wrong, okay, because it's from trauma. You don't have a trauma unless there's some kind of pathogen that attacks it. So it's misnamed degenerative joint disease, it's misnamed degenerative disc disease, and it's misnamed osteoarthritis. It's in the wrong category. You're just looking at trauma. Now, if the body has had a whiplash trauma, throwing this head forward or off to the side or something, okay, if those joints aren't regenerating, then the body, because the discs have a really horrible blood supply, they get their nutrients through movement. And so this is why the more you move your joints, the healthier they are. Yeah, I know what your mom said. Don't make that face and it'll stick that way. Okay, she was wrong about that. And how many moms in here said, don't crack your knuckles because they're going to swell up? Love mom, she was wrong about that one too. Okay, British Medical Journal did a study. They found that habitual knuckle cracklers had a remarkable lack of arthritis. And kids, your parents are right about everything else. I got to do the myth of parenting. Dude, parents know everything about everything. Okay, so this, if you have lack of motion of the disc, then the bones come down and that becomes unstable. So what you'll see in grade 3 arthritis is that the bone is literally remodeling to increase the surface area to stabilize. So now here's the mind-blowing thing. Not only is this not a disease, not only is it not inflammatory arthritis, this is an adaptive metabolic process to stabilize unstable joints. So this is protecting you. Now you're going to see arthritis actually reverse. All you got to do is create inflammation. Yes, I said create inflammation. Okay, create inflammation. That's how the body regenerates. And then create motion, because that's going to restore the movement and allow imbibition so the nutrients can get into the disc. And then guess what? The bone spurs go away. They go away. It's called Wolff's Law. Bones lay down where it's needed, resorb where it's not. This is out of Punjabi and White. Okay, I mean, this is just, or Kirkcaldy and Willis, another one, brilliant one. And what they found out is that the older you get, your joints are still just as strong as younger people. Okay, and this is why my kids can age and I don't. No, I'm totally kidding. Okay. No, the joints are always being regenerated. It's really, really cool. Okay, you just got to take in nutrients and keep that motion there. And this is why you'll see arthritis reverse. But what they did is they took joints from old cadavers, joints from young cadavers, put them under compressive, torsional, and distractive forces, and they found out they just worked as well. So the idea that your body breaks down when you age isn't true. But what does happen under chronic physical, chemical, emotional stress, you get in a sympathetic dominant state because you have this automatic nervous system. One part keeps you alive under stress. And when you're in a chronic stress state, you're not able to regenerate the tissue, or that rest, digest, and repair isn't working right. So it all has to do with your nervous system. I mean, you're looking at a 90-year-old yoga instructor. That's normal. We have people in their 90s, late 90s, that are still kite surfing, windsurfing, surfing. I mean, these guys are healthy, and this is going to be normal. In my lifetime, you're going to hear about somebody dying at 110, and you'll go, oh my God, what happened? He had another 15 years left. Okay, that's horrible. He must have fallen off a horse. So here's just a couple of things. A normal curve in the neck has a curve. Okay, and it's like that for cushion and shock absorbing. What you're looking at is a loss of curve, and with the head being thrown forward, we're looking at significant distortion of the disc and bone. It takes 3 to 5 years to see a bone change on x-ray. That's law. Okay, it could have been longer, it would not have been less. So when you see this x-ray up here and you see a compression and distortion of the bone, and somebody says, well, I got into a trauma last month, you can say, nope, it was over 5 years ago. I know. Okay, isn't that cool? So it's going to screw people up if they want to bilk the insurance company for something and say, oh, no, you were hurt before. But what's neat is if you do a stress x-ray so you can see if the joints are still mobile, you can actually restore it. But you're going to restore that by restoring the position and motion of the vertebrae and creating inflammation. Inflammation is how the body regenerates. Now, discs are incredibly tough. Now, I taught human dissection on and off for about 8 years. You can take a probe that kind of looks like a pencil, and you can pass it into bone pretty easy because bone's fairly porous. You can't beat it into a disc with a hammer. The disc has got 80 interconnecting rings of ligament. It's amazingly strong. So to herniate a disc is really, really hard to do. That takes a tremendous amount. And when people say, oh no, I herniated a disc because I just bent forward, it's turned wrong, Has anyone ever told you you can't bend and turn? Okay, don't lift while you're turning. Okay, I know there's a lot of physical therapists out there that are saying this because they were taught by ignorant teachers, and there's a lot of chiropractors saying they were taught by ignorant teachers. I'm going to give you a little bit of reality. Okay, me and the doc in the front row, 2,000 years ago, we're both hunting. He makes a beautiful spear shot on this ibex. And I say, Doc, be careful. Don't turn while you lift. Okay, does that sound stupid or stupid? Okay, yeah, because what happens is if you're sitting the way most of you guys are, you're increasing the pressure on the L5S1 disc. And if you keep that position, okay, that bent over position, you're reversing the discs. So when you get up, your body is already in a horrible position. So it's not the lifting, it's the sitting before. Okay, so discs are alive. Discs are alive. They get their nutrients through movement and imbibition. So what happens is First, you get a trauma that locks in the muscles. The disc doesn't get its nutrients. It gets compressed because it can't get its nutrients. Then the bone distorts to stabilize it. Okay, get that scenario? So the same thing in reverse. No, the same thing in reverse. You've got to restore motion. Okay, then the disc gets regenerated. Then the bone spurs don't need to be placed there. Okay, and then the body restores to normal. It can't be that simple. But we're looking before and after. And this is Acro Yoga. If you're not familiar with Acro Yoga, because I wasn't familiar with Acro Yoga. Yoga I've done before. Bergman and the hot yoga, regular yoga, all through college. This is you hold somebody like this, their legs are going like this, your legs are like this, and then you decide to do a cartwheel. I know. It's totally cool to watch, but it's wild. But we're looking at acro trauma and then secondary. Now, I've got marked in red the hard palate because that palate can move up to 15 degrees up and down without negatively affecting the neck. So when you're shooting an x-ray, you have to shoot the hard palate. Okay, and this is called X-ray Technique 101. Now, here again, you're looking at loss of curve, restored curve. I mean, it seems too simple to just go over case after case, but I mean, I'm talking every 30 adjustments. Okay, when a person starts with it, we're shooting a post x-ray. Do you know why? Because 90% of the nerves that come off that spine, there's no pain fibers. If you say, gee, how do you feel? That's foolish. Okay, because you're getting less than 10% of the information, and it's going to make the person think, wow, I guess how I feel is important. I'm telling you, feelings change. Anybody in here married before? Okay, so C3, C4, C5 keeps you alive. What does that mean? That means the nerve to the diaphragm comes out of the base of the neck. So does that mean any respiratory issue, chronic obstructive pulmonary disease, asthma, bronchitis, emphysema, is breathing important? Yeah, you got a big flat wide muscle here called the diaphragm. And that thing is innervated by the neck. So do you think maybe a neck trauma could alter the function of that? Yes or yes. You've got the stomach going through it. You've got the esophagus. So if you alter the tone of that diaphragm, do you think maybe the stomach, the fundus of that stomach can pooch up inside of that diaphragm, causing a hiatal hernia? That's what a hiatal hernia is. Can you imagine being so incredibly stupid that you're going to try and correct a hiatal hernia without looking at the neck? What do? You got a freaking crystal ball? No, you got to restore the nerve supply to it. Then you got to restore the function of it. And then you can get a good idea to fix the hiatal hernia. Does that make sense? Can you imagine trying to correct a hiatal hernia without restoring the nerve supply to it? Yeah. And give them a drug too. Okay, I know it doesn't work that way. Okay, oh, now this is kind of cool. You got sensors in your neck, and just to show the importance of correcting the friggin' neck. Okay, well, my neck doesn't hurt. I don't care. You only got 10% of the nerves has awareness. Now, you've got this carotid artery that comes up. It splits to go into internal and external. Now, right at that junction are two sensors. One sensor checks the carbon dioxide. The other sensor checks the blood pressure. Okay, now if the carbon dioxide levels are high, and the body uses carbon dioxide to balance the pH, because you got a really narrow acid-base balance. Okay, 7.35 to 7.45. It goes up a point, you die, down a point, you die. So if your carbon dioxide levels are up, then the heart rate increases. So you're getting more blood to the oxygen. As the carbon dioxide levels go down, the heart rate decreases. So you get this carbon dioxide balance here to balance out the acid. Also, if you're doing a chokehold on someone, you can, because this baby is connected to the heart. If you do a chokehold incorrectly, you can actually stop the person's heart. And this is why a lot of police forces out there were doing chokeholds to try and protect the person. And they found out that if you did it in the wrong way, you can literally stop the heart by choking the person. And so, I mean, just to look at the structure, and when you so look at this, you think, well, wait a second. So blood pressure is dependent on the carbon dioxide transfer. Does that mean that everybody with an abnormal blood pressure might have a problem with carbon dioxide oxygen transfer? Whoa. I know. Go on, say it right now. My mind is blown. That's so weird. I didn't know breathing was important in blood pressure. Okay, except there's tons of machines out there, one of them called Respirate, that all you got to do is diaphragmatic breathe for 15 minutes, and it's more effective than 2 blood pressure drugs. And so the doctor of the future is going to say, well, sir, you got high blood pressure. You got to start breathing every day. Okay, and I mean on a consistent basis. Okay, really, doc? Okay, yeah, breathing every day. It's actually really good for you. Mind blowing. So now let's get into the pathologies. Okay, high blood pressure does not cause a headache. A headache will cause high blood pressure. I know 3 people in the back just went, my mind is blown, dude. Okay, so if I stand on your foot and cause you pain, will your blood pressure go up? Yes or yes? Okay. Now, if you're working out at the gym, okay, you're lifting it, your face is turning red. Do you ever see someone at the gym put the weight down and go, oh, my blood pressure is high. I just can't do it. It's just, I have a headache now. No, does that sound foolish or foolish? It's ridiculous. Okay, but you get these morons passing out these toxic chemicals to lower the blood pressure, to force the blood pressure lower, which actually causes an increase in stroke. It's mind-blowing. Okay, but a headache pain, now 93% of all headaches are coming from the neck. Okay, typically it's 93 to 97%. You've got alcohol, toxicities, dehydration. Those are also going to be contributing factors. Less than 1/10 of 1% are from other issues. So if you have a headache, fix the neck. Wait, did I say that too fast? Your body gives symptoms for a reason. Listen to it and correct the problem. I know. One of my best friends is in the front row. He's a medical doctor, and he's not saying, gosh, just give a drug. Just give a drug. Cover up the symptom. No, you can't do that. Okay, and we're going to run through a couple of different types of headaches. Sinus, migraines, and most people that are having migraines don't have migraines, they're having sinus issues. And I'm going to show you how to correct that. General headaches, how to correct that. Eye strain headaches, stress, allergies, insomnia are going to have it. So when we're looking at a sinus headache, one of the greatest ways, and this is sinus headache or migraine, put one hand here, and squeeze together. Okay, if you notice a change in symptoms, now this could be an increase or a decrease in symptoms, because what happens is you've got these sinuses trying to explode out. They're full up. They can't get drained. Okay, so if you do this, you're equalizing the pressure. Now, the majority of the kid patients that I see are damaged through certain medical procedures, and they have sinus issues, but they don't know about it. I mean, these kids have been hurting since birth. They have nothing to compare to. So, I mean, you'll typically see like an 8, 10, 12-year-old kid, really stoic, maybe mildly autistic, maybe some brain damage. How are you doing, sir? Oh, fine, fine. One-word answers. If you go up to them and apply this tiniest little bit of pressure, you're going to see their entire facial structures change. It's like, oh. And when I do that in front of parents, and I've only done this several thousand times, okay, you're going to see the parents go, whoa. I say, yeah, man, he's been hurting so long for so many years. He can't tell you because this is his normal. So how do you correct it? Well, number one, you got to restore the nerve supply. Because, I mean, think of this. Has anyone in here, your arm ever fallen asleep? Every guy's going to go, oh, you betcha. When it's around my girl, I don't care if that sucker falls off. It's around my girl. So what does it feel like when it comes back? It's all pins and needly. That's because when you compromise a nerve, it gets more sensitive. So if you compromise a nerve that supplies those sinuses, they're going to be hyperactive. They're going to go crazy over temperature changes, cat dander, whatever. Okay. So you got to desensitize that nerve system by getting adjusted. Spicy foods will thin the mucus. There's cayenne supplements, in any kind of spicy foods, virtually. Water is going to start to thin the mucus and allow the body to drain. Fresh pineapple, bromolamine, fantastic. Steam helps. Okay, we'll put, when my kids were little, we put eucalyptus leaves in and steam them and have that steam go in there. There's so many ways to do it. Referred trigger point headache. And this is going to be a headache over one side. It's called an ipsilateral. So it's going to be pain over the eye, over here. And if you look, like if you have one of those headaches, it's usually because you're on a computer or down, because when that head goes forward, the muscles start to increase in tone. And you can go between the neck and the shoulder halfway. There's going to be like a golf ball of tissue. So you can apply pressure and hold it down, or you can put your elbows on something and lift your chin up and deep breathe. The worst thing you can do is to massage those muscles. The worst thing. Okay, why is that? Because the body's smart. For every 1 inch that heads forward, the pressure on the disc doubles. So when you have massive forward head carriage, these muscles are screaming to reposition it. So if you relax the muscles that are tight, which way is the head going to fall? Boom, further forward. This is why when you're going to somebody that doesn't know how the body works, if you see any of those people on the bottom, okay, and you relax that muscle, that's insane. So what we do, we tell them, put their elbows on a counter, restore the curve of the neck, and deep breathe. It can't be that simple, but it really, really is. Okay, or get the body adjusted and it helps. Heavy metal and acute migraines. Okay, this is going to be dental toxicities. And this is why we do thermographies on everyone to look for areas of increased metabolic response. But it's so wild that all you got to do is detox the system. If you're in a dark room, this is going to allow your eyes to work better. Like if you're working on a computer, which is the majority of people, you're not constricting and dilating your eyes. They're always in looking in one place. This is why we're having a huge amount of retinal detachments, of cataracts, and everything else, because we're not using our eyes or bodies the way it's supposed to. So if you have an eye strain headache, and this I want you to go do along with me, unless you're listening to this on the radio and you're driving. Don't do it while you're driving. Okay, so what you're going to do, you're going to cover your eyes so it's super, super dark, and make it super, super dark so your eyes are covered. Now you're going to open your eyes, but keep it dark, and try and focus in to see your hands. And I know it's weird because the eyes are going to start to dilate, and that's going to relax all the muscles inside of the hand. So if you're doing this correctly and it's super dark and you're trying to see your hands, you're going to feel your eyes literally relax. Isn't that cool? I mean, it works really, really good. Now, these are skeletal muscles. The muscles inside are called intrinsic or smooth muscle. Now, these guys relax super, super quick. You only got to do that for 20 to 30 seconds, and it's going to refresh your eyes. I know what you want to say. Cool. Oh my God. Okay, yeah. Medications give you an over medication headache, or whatever you said. The worst one is Imitrex. I mean, this is like, there are so many drug dealers, okay, in Colombia that are salivating over Imitrex. It causes a rebound headache, and what's it for? Headaches. Yeah, baby. Okay, and it's poisonous to your body, but your body requires it. This is like pre-opioid crisis. Wait, there's not really an opioid crisis, is there? No, there's a toxic chemical crisis where these drugs are prescribed for people's adaptive stress behavior. Okay, that's the crisis. It's not like we're going to blame the opioids. No, these people shouldn't be prescribing them. That's just foolishness. Okay, Cayenne pepper. Oh my God, 33 studies found that this works better for a cluster headache. Now, why would somebody prescribe cayenne supplements? Well, it's a vasodilator. It allows oxygen to get to the system. It's got soluble fiber, so it's going to clean the arteries. It's loaded with vitamin C, which will actually decrease certain inflammatory responses. It will thin mucus in the sinuses. Wow. And you know what's weird? You could actually eat this. Okay. And we could even say, let food be your medicine and medicine be your food. I know someone's already said that. I know I'm plagiarizing. Okay. But it's okay. It's still truth. So when we look at this, physical, chemical, and emotional stress, all three have to be addressed. All three have to be addressed. So when you're looking at this, physical stress, you're going to identify an x-ray. Chemical stress, you're going to identify on a thermography and a blood cell analysis. Emotional stress, you're going to identify by talking to the person. Okay, this right here is a breast augmentation that's being expelled by the body. When you get a foreign object in your system, now I covered up the nipple area so you can't see the stuff, but I want you to see the inflammatory response on the outside. Now, saline implants are still covered in silicone. This is the person's body rejecting it. This is dangerous. Now, lymph drainage for the lungs and mouth, okay, drain up to the right chest area. So we're looking at dental toxicities. We're looking at gut toxicities. This is why 85% of all breast cancers are on the left side, 15% are on the right. Now, this is not cancer, but this is a major, major chemical stressor. Okay, and we're going to see this a lot. You can even see in the thoracic area, the rib cage area, that there's a structural deviation. So what has she got? The nerves that come out of that top of the thoracic area supply the upper thoracic. So that means that that tissue is compromised nerve supply. You need the nerve supply there in order to regenerate the tissue and to help. So what came first? The toxic environment, okay, where you have a foreign object in there and the body's trying to reject it, or the altered nerve supply to it. Do you know what I mean? Okay, it's a combination of all of that stuff. And then poor sleep patterns and high stress. Just know that if you have this, an explant is hugely important. And there's ways to do it. I mean, every patient, and I've seen probably over 100 people with explant surgeries, and they all make out. They're all scared to go in there because they like that figure that it gives them, but they also like living healthy, strong, no joint problems, sleeping good, functioning well. So I mean, please look into that. I mean, this one here, blood viscosity on stress. Emotional stressors will increase the thickness of your blood. That means the blood can't hold oxygen. So when we talk about physical, chemical, and emotional stress, if you're emotionally stressed, that blood becomes thick. It's going to start to get, your pressure has to adapt. So it's going to be harder to get through the kidneys. It's going to be harder to get the blood-brain barrier to have fluid. It's going to be harder to get into all the joints. So if someone is in a chronic state of emotional stress, guess what? Every joint's going to hurt. You get every joint hurting because all the joints are hydraulic. Do you think you're going to be happy or sad? Or it's a self-perpetuating thing. This is why we talk about neurolinguistic programming to change that. Mitochondrial damage. Now, if you knew that Advil, Motrin, Aleve, if you knew that the beta blocker, the hydrochlorothiazide, the diuretic, if you knew that the NyQuil, the Dayquil, okay, all of these medications will lead to a dysfunction of the mitochondria. That drug, and I just had a patient, God bless her, I love her, I've known her for 15 years. She's taking 12 medications, some of them multiple times a day, and she takes NyQuil at night to sleep. And well, what am I supposed to take to sleep? Okay, see, some people are in such a dark place. They don't know that drugs don't help your body regenerate. Okay, so every one of those drugs, cholesterol-lowering drugs, acetaminophen, okay, this Tylenol, can lead to dysfunctions like schizophrenia, bipolar, Alzheimer's, epilepsy, migraines, strokes, neuropathic pain, Parkinson's, ataxia, transient ischemic attack, chronic fatigue syndrome, diabetes, hepatitis. And I know what you're thinking. Wow, we have a lot of drugs for those. See how insane it is? But this is a pharmaceutically controlled industry, pharmaceutically controlled government, and pharmaceutically controlled media. So I'm suggesting that you do some more natural approaches. Antidepressants linked to brain bleed risk, okay, which is a bummer because you only have one brain. Okay, this deprescribing to reduce dementia. Dementia rates in America are virtually 1-to-1. As you age, you're going to lose your mind, okay, because you're following the medical system. Okay, so now they're talking about, maybe we should deprescribe, and there is no science about this. When you look at the drug you're taking for depression, okay, with the antacid, with the muscle relaxant, with the pain reliever, okay, there is no science behind this. Nobody knows what those drugs do together. I mean, you give one drug to 20 people here, are they going to have the same reaction? No. Give 3 drugs to everyone and then try and find out what caused the problem. That's insane. Okay, so antihistamines. Histamines are a part of the body's repair process linked to Alzheimer's. Tylenol, PM. How would you like to take a drug to get sleep and then realize you're starting to lose your mind? Okay, so when we look at this, the integrity of the blood, we know physical, chemical, and emotional stress will thicken the blood. We know that little 2.5-pound brain burns 90% of the body's oxygen. So if you're altering the oxygen carrying capability of the blood, does that alter the function of your body? Yes or yes? Okay. Okay. So when we're looking at this, whoops, I got to get by this real quick. Neurotoxins and neuroplasticity. Okay. You got to break down certain things in there we can't mention, and then you got to build up. And your body's always breaking down and building up. Okay. Does that make sense? The brain functions altered by nutrients, so you can have organic and healthy the way your great grandparents got, or you can have processed and packaged and insects the way that your children are probably going to have, unless we change the world. Okay, stimulus. You can have a massive stimulus, okay, of exercise every day, or of massive trauma. You can have neurotoxins, industrial medications, things like that. So when we look at this, we've got a normal neck curve, Parkinson's. And you're going to see that the spinal cord itself doesn't have stretch fibers. So when you're moving this forward, you're literally pulling on the brainstem, and the top of the brainstem is where some of the dopamine is produced. It's not the only area, but we know when there's forward head carriage, there's a problem. This is why 9 out of 10 Parkinson's patients, and what is that, 90%, had some type of incident of trauma before the onset. Okay, and within 10 years, I'd say it's 10 out of 10. Here's a gal, 76 years old, before and after. Do you see the curve coming back? Yeah, you're talking wheelchair to cane. When we're looking here, does this person have high blood pressure, indigestion, and low thyroid? No, that's what they were diagnosed with. If you bend your body like this, are you going to have a good oxygen transfer? Do you have some kind of problem there? Yeah, probably. If you go like this, can you breathe better? So is the high blood pressure an adaptive response or an adaptive response? It's an adaptive response. Now, the heart has 2 nerve supplies. One of those nerve supplies comes out of the top of the neck. The other one comes out of the top of the thoracic area. Okay, now all the muscles that support the head stop at the top of the thoracic area. So if you have a problem or challenge like this, do you think you might be altering the nerve supply to the heart? Go on, say it with me. Whoa, mind blowing. So if you have cardiac arrhythmia, shouldn't you look at the nerve supply to the heart? If you know that the nerves that supply the heart come out of the neck and the top of the thoracic area, does this mean everybody with heart palpitations, cardiac arrhythmias, okay, or abnormal function, should you get that checked? I know, it's like simple. We know that if you limit oxygen to the brain, now this is an article out of 2006, that people are wearing this weird type of mask, okay, that limiting oxygen can induce a headache. Then we have another one from 2020 that also says that it can cause a headache. That it turns out that covering your face isn't really good for your physiology. I know, I should have cleaned this up. Okay, no wonder we were kicked off. Okay, so now we're going to correct this problem. Now we have these little things that I mean, it's literally pipe insulation and a webbing. Okay, I know, ex-contractor, but it works. So you pull down with about 2 pounds of pressure and look up. You can do this on a collar and look up. You might distort the shirt, but this is, and you're only pulling down with 2 pounds of pressure, and you look up. Okay, then look straight and relax. So this is an imbibition process that restores the curve in the neck. You can also put your elbows on a kitchen counter, lift up, and deep breathe. That works out really, really well. I would not recommend rolling your head in circles because most people have loss of curve in the neck. If you're going to move your head, go to the neutral, go up, go to neutral. I wouldn't even recommend putting your chin to your chest because most people have loss of curve in their neck. Okay, when you're looking forward, turn your head far to one side, back to neutral. Far to the other side, back to neutral. ear down to the shoulder, back to neutral, ear down to the other shoulder, back to neutral, but not in a circle. Circle is coupling motion. You don't want to do that. Although it looks totally friggin' cool. Like, if you've ever seen the Joffrey Ballet, oh my God, that's like living art. Back when the society was more normal, we would go to that all the time. It's like amazing. When you're adjusting, okay, the head is turned no more than 10 to 15 degrees. It's not whipped around, okay? I know I saw too many karate movies, okay? And we're using a fingertip. This is the simplest adjustment ever. But is it powerful? I need an amen. I know there's few people in here that have been adjusted by me. Okay, it's only the fingertip, but oh my God, it does seem pretty dramatic. But you do a series of adjustments and you're literally going to create inflammation. You're changing the ways the brain views the body. It's the only thing that makes sense. So correcting and detoxing, this is literally how you reverse the arthritis. One, you got to identify the problem, physical and structural and neurologic correction. By neurologic, I mean that we're moving the position, motion, but communication. So we're changing proprioception, or how the brain views the body in space. Chemical, if you identify a chemical stressor, explant, oral chelation, IV chelation, but let food be your medicine. I mean, every time you're going out, get some extra cilantro in your smoothie. Great detoxing. Okay, when you got a choice of having an ice cream from a cow, freeze some bananas and run it through a juicer, a masticating juicer. It's delicious. Okay, I mean, it's banana ice cream. It's just a banana. You put a little honey on it. Now it's honey and banana, and it tastes delicious. You want another bowl, buddy? Here it is. And emotional. You have got to address the emotional component. Otherwise, the muscles don't work. That's why we put nerve supply, exercise, nutrition, rest, and prayer and meditation. It's literally how your body regenerates, because your body is always in a regenerating phase. We're going to get into some scary stuff. Okay, so I can't say goodbye to YouTube because they're not on here yet, but this will be posted in a week or so. So Dr. BVIP, hang in there. We're going to go into the realm of the dangerous information, because the government says that this information is dangerous. I know. Doesn't it make you want to see it more? Okay, it really does. It really does. It's like you're driving down the freeway and it goes, I can't look. Oh my God, whoa.